If you've been told that you have knock knees, that you have a very pronounced knee valgus, or even if you have knee osteoarthritis, I strongly recommend you watch this video until the end, because I'm going to open your eyes about the muscles and areas we need to work on to protect your knees and keep them healthy for as long as possible. A brief explanation. In valgus, what happens, this is a right leg, is that the knee collapses inward. But if we put both knees flat, we would have a position like this, forming an X between the thighs and the legs. This appears largely due to wear inside the knee joint. But there are also many muscles involved in its appearance that we can work on to delay it, and to maintain good quality in our knees for as long as possible. The first muscle we should work on is the quadriceps muscle, which is basically the most muscular, largest mass we have in front of our knee, especially the vastus medialis, which is the most medial bundle inside the thigh. This bundle helps stabilize the knee and protect it in all our daily activities.
But that's not all.
A weak foot, a weak plantar arch, especially the muscles that support our foot, can also cause the knees to collapse inward.
Basically, look how by doing this small test, we can see it.
Stand up with your feet shoulder width apart and place your feet on the outer edge of the sole. As you can see, when you do it, the knees tend to move outward. Now try to do the opposite. Place that foot on the ground and push it inward. When you do it, what you'll get is an X position and a more pronounced knee valgus. The secret is not only in the foot, but also in the glutes. Put your hands on your buttocks and contract them firmly. Exactly, those glutes. If you look, the pelvis moves forward and the legs rotate outward. In fact, you can notice how contracting those glutes also increases the plantar arch and the contact of the foot with the ground. This external rotation fights against that valgus, which is exactly the opposite movement, and it can also help us prevent it from appearing. It may seem complex, but just focus on the simplest part. We need to work on the knee internal stick, plantar arch, and gluteus maximus. With that, we'll have all the muscles worked and all the areas covered to delay the onset of that osteoarthritis and that knee valgus. So let's start with the simplest exercise, which is strengthening the plantar arch. The only thing you'll need is a chair to sit on and a floor to rest your foot on. I want you to think about the 2 points of support your foot has on the floor right now. One of them is right here at the base of the big toe, and the other is right here at the heel. Between those points of support, what we find is the plantar arch, which rises from here all the way to the heel. You can assess how high your plantar arch is by trying to slide your fingers under it. If you can hardly get anything under there, it means you have flat feet. That's causing the knock knee to develop. If you can slide your finger in up to the first phalanx, like I do, it means your plantar arch is normal and strong enough to support the arch of your foot. Regardless of the result, it's ideal for us to work on it, since those muscles tend to weaken over time, especially after the age of 50 or 60. How are we going to do it? By trying to bring those 2 points closer together. The support points are the thumb, big toe, and heel during a voluntary isometric contraction. Pay close attention to what I'm doing. I contract that muscle, the plantar arch increases. We can notice here how that muscle is contracting. It becomes harder. And then I relax. We can put those fingers right under here and notice that when we contract, that part of the arch lifts slightly. We hold and relax. Let's move the camera closer so you can see better. There it is. Take a look. I voluntarily reduced the support between these 2 contact points by contracting. You noticed that, right? A minor contraction at the back. Notice how that plantar arch increases, and then I relax. The whole foot relaxes. The muscles that maintain that arch are not only here, but also run behind at the calf level. Let's do the 4th repetition. Pay attention. Can you slip a finger in to feel it more? I contract 1, 2, 3, 4, 5, and relax. You noticed it, right? With that camera we've set up with zoom, it's much clearer. Let's choose the 5th. I contract, 2, 3, 4, 5. We tangle and relax. Very good. Let's do 5 more. As I mentioned, you can insert a finger to feel the muscle contraction inside the plantar fascia, count to 5, then relax. Don't get discouraged. It's difficult to get it right the first time and coordinate, but I've been doing it with traction for a long time. The important thing is that you try. The more you try, the more effective the exercise will be. Your brain will send better commands to your muscles, leading to improved results. As with anything, practice improves skill.
Let's do the last 3. Contraction 1, 2, 3, 4, 5, relax. Contraction 2, 3, 4, 5, relax.
I suggest doing it on both sides.
Foot muscles are often overlooked, but they support knee health and balance, especially for older adults.
Contract 2, 3, 4, 5, relax. Last repetition, let's go again. Contract 2, 3, 4, and 5. Remember, what I'm trying to do is bring this support closer to this one, as if I wanted to increase that arch. Plant at foot level, we stand up and continue with the second exercise. And it's a squat with the outer edge of the foot to strengthen again those muscles at the foot level and also the muscles at the glute level. I suggest doing it near furniture, a wall, or a chair. It's especially important that we stay safe while doing the entire routine. I want you to place the outer edge of your foot and spread your feet about a little wider than shoulder width apart. From here, we don't need to try hard. I'm just asking you to bend your knees a little, about 30-40 degrees, and then stand up completely, keeping that support on the outer edge of your foot.
What are we looking for with this?
Again, greater contraction of that plantar fascia, more stability, and also starting to engage the quadriceps and the gluteus.
So again, let's get into position. We're going to do 10 repetitions.
If your feet bother you, put on some shoes. If you lose your balance, stand near a table and let's go for it. Go down as much as you can, return to the starting position. Let's count the previous one. That's 2. Go down, come back up. In the squat, we try to push our buttocks back. We try to bend at the hips as if we wanted to sit down on the floor. 3. Let's go again. I go down, always on my outer edge. Come on. The foot that stays on the ground. Let's do it. I stretch, I pretend. We go down, up. 6. We go down a little, we come back. 7. And if you feel comfortable, you can try to go further. Here I'm going down more and more. 8. We have 2 left. I stretch. Last repetition. We go down.
And one more as a bonus, because we can't really count the first one either.
And up. Very good job. Glutes, quadriceps, feet. Now let's move over here to Tomba 2. To continue with the simpler exercises, follow me. We continue with one of my favorite exercises for glutes. The clam exercise, for which we can also use a small elastic band to make the movement more challenging. It's very simple, it goes to the basics, and without overcomplicating it, we're going to lie on our side, and it works well. I want to position my legs at a 90-degree angle, just like I'm showing you here, with my feet right below my buttocks. As for the upper part, we can place one hand to support the head and the other hand on the floor to stabilize the torso.
This is a movement that should only be performed at the hip level.
We will try to avoid moving the chest spine during its execution.
From here, keeping your heels together, I want you to separate your knees as much as possible, opening as far as you can.
The exact point is when you see that your body starts to drag, when your gaze shifts from facing forward to facing the ceiling. We have to avoid that. We hold the position at the end for a few seconds. 1, 2, 3, and we relax. We touch together very slowly, very controlled. We open 1, 2, 4, and we relax. We're going to do 10 with the right leg, and I'll show you a second variation with a band with the left leg. We relax. That's 3. Let's go for it. I separate, hold the position, 1, 2, 3, 4, and relax.
Where will we feel it? Mainly in the glutes. Some may have limited hip mobility, while others might feel it only slightly.
Don't worry, because we're going to add a challenge in just a few moments. Let's go for the 6th one.
2, 3, 4, 5.
Relax, separate. Pay close attention to my heel, and my feet are always in contact with each other. Relax, I have 3 left. 1, 2, 3, 4. Relax. Last 2.
It may seem simple at first, but done right, this exercise will tire you out.
I practice this very often and I have strong glute muscles, but look, I'm really feeling my glutes getting tired. To switch sides, basically what we're going to do is turn our head to the other side and use the band. I like to combine it with a little clip because the clip is going to help us add tension.
What do we want?
Let's get into our starting position. We're going to use that little clip to add a slight tension at the knee level. We close, we get into the starting position. Remember, it's crucial to keep your heels directly under you and your knees at 90 degrees. With your hand in front, separate your knees. Same principle, except now, my friend, you might not open as much, right? Because that elastic band is extremely limiting the range of motion. We hold strong for 3 seconds at the end of the movement, feeling how that elastic band restricts our motion. Let's go for it. We've done 3. Hold for 3 or 4 seconds at the top, and if it's not tight enough, just tighten the elastic band more. Okay? 4. Separated 5. I have 5 more left. Separated 6, separated 7, separated 8, last 2. Let's go for them. 9. Last rep. That's it. And 10. Let's relax and remove the band. Nice work. At the glute level, we can tap it a few times. If it's very tight or fatigued, we'll move to a more specific gluteus medius exercise. One of my favorites. I recommend doing it on both sides. We're going to do it during the video because if you don't do it this way, you might not. It throws you off balance. I'm going to move up a little so I don't get out of the frame. I rest my head on my hand again. I fully stretch my leg toes forward while keeping the lower leg bent. From here, see my toes touch the floor, then I'll lift it, but not too much. 30, 45 degrees, don't overdo it. Lower down, touch, and lift back up. That's it. The key is the tip of the foot. Watch, I'll show you up there. It always has to be facing forward. It shouldn't be like this. That's completely wrong. It has to be like this. Because this way we're putting maximum muscle tension on the gluteus medius, just like the leg. It can't be out here in front nor back here either. It has to be in line with the body. We touch down and lift up. Very good. 4 or 5, I don't know. Touch down and up. 6, touch down and up. 7, we have 3 left. That's all. Touch up. 8, 30, 40 degrees. Don't overdo the lifting, because the point of maximum strength is more or less here at the horizontal. Last one up. And relax. Rest one leg over the other. Small taps at hip level, and we switch. Because it's extremely important to work both sides. Let's go again. I place my legs just like we started at the level of the shell. I stretch my leg all the way up.
Toe pointing toward me. Don't forget, this toe doesn't have to be facing the ceiling.
That's incorrect because the pelvis is positioned differently. It needs to be more forward. And from here, what we're going to do is lift that leg without losing that position. Notice how the tip of the foot goes forward and then we lower it. Without letting it touch the ground, we go back up without giving it much rest. 2, let's go again, up, 3 up, 4 up, 5. Feeling of fatigue at the hip level, 6 at the pelvis level. Here on the side, 7, 8, the last one's 9, last repetition we touch, and 10, very good. Support, leg, I tap right there where that muscle that might be fatigued is, and I breathe. Remember we did the first 2 exercises focused on the foot. Now, with this one, we'll finish with the 3rd glute exercise. And we'll dedicate a final part to working on the inner vastus of the knee, the quadriceps. That's what it's called. As the last exercise, we're going to do the frog bridge. We have 2 ways to do it. With or without a band, I'll show you both. The simplest one is without a band, okay? We place our legs at a 90-degree angle, bring our feet together, as you can see in this top photo, as if they were right. Don't forget to like the video. See you in the next video. Until next time, goodbye, 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 goodbye. goodbye, 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 goodbye. From the starting position, we wrap that elastic band around our knees. Close it. Not too tight, we're just looking to add a little tension, a little resistance. We click, let the knees fall outward. Place those feet, as we've seen before, with the soles of the feet together. Now it looks worse due to the elastic band. Keep that tension, play, boom, and lift the pelvis. It's basically the same, except that we add external resistance when we separate our knees. Let's do 10 repetitions together. Take a breath at the bottom, bring feet together, lift up and squeeze your glutes hard, like you have a credit card between your butt cheeks and you don't want it to fall. Touchdown, come back up. 1, 2, 3, 4, 5, relax. Touchdown and come back up. 2, touch, 4, 5, relax. Come back and come back. 3, 4, I think, touch up. 2, 3, 4, 5. Very good. Let's do the last 5, 2, 3, 4, 5. Let's switch cameras so you can see me better. Touch and up, 3 left, touch and up, 2. Last rep up. Let's do one more as a bonus, just in case I forgot any. Good contraction at the top and relax. Valid movement with the legs to relax. And with this, we finish the glute workout. Now let's focus on our quadriceps. We remove this clip, set the elastic aside, and get a cushion. Here we have it. Let's lie on our backs here, keeping one leg bent and the other fully extended. I want you to take that cushion and fold it in half to create some volume. Next, place it right under your knees so that it's slightly elevated off the floor. You can do it sitting or lying down. Choose what you prefer. The more upright you are, the harder the exercise. From here, we need to focus on our knee and our heel. Pay close attention. I want the tip of that foot to be pointing only straight up, not turned completely outward. Let me switch cameras to show you better. Here we are. The foot has to be completely facing up. At no point should that leg be rotated outward. From here, I want you to focus on the space between your knee and the floor, the space that the cushion is covering. I want you to press it down as much as possible without lifting your heel off the floor. An absolutely essential point. We press the cushion down, reducing its space. Here we will notice a contraction at the level of our quadriceps, and we count 1, 2, 3, 4, and 5. How are the sensations? Good, I'm glad. This is the simplest quadriceps contraction, which is the most important muscle when it comes to protecting our knee. If all goes well, we'll add a step. Bring your foot stiff toward me. In addition to pressing down with my knee, I want to bring the tip of my foot towards me, which creates a synergy with the knee muscles. And the contraction is performed with better quality. Okay, let's go for it. I lie down, get comfortable, and I want you to do 10 repetitions with me. Remember, keep your foot pointed toward you, then up to the ceiling. There, we don't move that leg to the side and we bring that knee back, pressing down on the cushion without lifting the heel off the floor. Let's go for it. Relax. Press the tip of your foot down firmly and hold. 1, 2, 3, 4, and 5. You should notice that these muscles get at least a little bit harder. That's a very good sign. It means we're directing the effort where we really need it. We relax, point the toe, the heel doesn't lift. 1, 2, 3, 4, 5, and relax. 2. Let's go for it. Point the toe. 1, 2, 3, 4, 5, 3, and relax. Let's do it again. Point the toe toward me. 2, a 3, arch, 4, 5. We've done 4. Let's do 5 and then add a small variation so you can feel it more. Press down, tip of the foot, and 5. Great job. If you did well, you can go all the way and do 10. I'm going to suggest a slightly different variation that combines a bit more knee movement and intensity. Now, instead of keeping your heel on the ground, lift it up and separate it. and this small change will make the exercise more challenging and create more tension in your knee. If this causes you pain, stick with the previous one. If the previous one seems too easy, try this level 2. Okay? Very simple. It's the same principle. We press down with our knee, toes pointing towards us, but this time I want you to lift that leg and keep it completely straight between your hip and your knee. Greater contraction, greater feeling of muscle work. Here we do 5, and you try it at home. We do 1, touch down. I press and extend my knee with toes pointed at me. 5, 2, just 3 left. I press down, lift my toes, 3, and relax. I press down, lift my toes, and hold. 5 seconds, 4, relax. Last repetition, I press down, extend my toes, and relax. Great, let's take out that cushion. We have already done the most basic exercise and level 2 in terms of quadriceps muscle contraction. We do some small bi-bend movements with bent knees. It feels better. And now we're going to do a slightly more difficult exercise, for which, honestly, we're going to need it again. That cushion, I don't know why I threw it away, but we need it. This time we're going to place it here at the lumbar area. It's going to help us protect that lumbar area, that spine, especially if you have pain when you lift your legs. Because that's what we're going to do. Lift the leg. The same principle, the whole leg extended, toes pointing toward you, a very straight line from hip to ankle, and from here, I lift the leg, only about 15 to 20 centimeters off the ground. I hold the position, then relax. Muscles that work, quadriceps, psoas muscles, essential for protecting that knee. If you have lower back pain, place that cushion to give yourself a very good support base. If you're very uncomfortable, pull your belly button in to protect your lower back. Keep that core tight and you'll be able to exercise safely. Let's do 10 repetitions together. Lower 2, let's go again. We're switching the camera so you can see it better. Tiptoe, lift up and lower 3. We only have 7 left. Let's go for it. Tiptoe, foot up and lower. 4, tiptoe, legs straight up. 5, lower. Let's go again. Tiptoe up, 6, lower. Tiptoe up, 7, lower. We only have 3 left. Let's go for it. Tiptoe, foot up, 8, lower. We have 3 repetitions left. 2. Sorry, haha, tiptoe. You've probably already noticed that numbers aren't my strong suit. 9, last repetition, tiptoe up, that's it. And 10, very good. These are extremely simple exercises, but honestly, they produce a great muscle contraction. You just need to think, to connect that muscle with your mind so the contraction is more effective. You don't need heavy weights, you don't need big exercises or very complicated exercises to really start noticing benefits and muscle work. At the quadriceps level, you grab your knees, roll, and you're already in the starting position. We have done some work at the foot level, remember standing, a very important job at the hip level, and we finished with the quadriceps. We have worked on the 3 most important causes at the knee valgus level. You no longer have an excuse to improve your knee health and your quality of life. If you liked all of this, remember that we are doing Knee Week from September 8th to 15th, a unique event that only happens once a year, where you will learn a lot of exercises like these. But above all, you'll get a lot of tools, strategies, ways to deal with pain, and obviously to live a better quality life. To sign up, I've left you the link below, in the first comment in the description. Just click, enter your email, and that's it. We'll see each other on the night of the 8th, that's all. I want to sincerely thank you for staying until the end of the video. Hope you can share it with those people who need it, who have knee problems, knee pain, or even those who haven't thought about having surgery. Since exercise is always a source of health and is always the first tool to relieve pain. That's all. Thanks again, and I'll see you very, very soon in one of my other videos. Bye.